Hello and welcome to session 6, our final session where we will talk about medication. Don't forget to have your pen and paper handy, just in case you have any questions. APEG attendance and medication. Many parents believe that attending APEG guarantees their child will be prescribed medication. This is untrue. Not all children require medication, and whether they do or do not is decided by the medical team based on history, QB levels, and any comorbidities. Medication is only a very small component in the management of ADHD, and so parent education is key to help children with ADHD meet their potential. Strategies to manage ADHD and implement change take approximately 12 weeks to embed before results are seen, and so this is why we require a 12-week period post-APEG before considering a referral to discuss medication. In very rare cases, and based on clinical factors, medication may be prescribed prior to APEG attendance. This is rare, and due to confidentiality, we cannot discuss individual cases. Why medication? The brains of young people with ADHD have a chemical imbalance in the part of their brain controlling hyperactivity, impulsivity, and concentration. Medications used in the treatment of ADHD work by stimulating the brain to release the required chemicals. Some medications need to be taken every day, but some can be taken just on school days. Treatment breaks are occasionally recommended to assess whether medication is still needed. Medications don't cure ADHD. Children with ADHD still need support and encouragement. Recent research indicated that 30 minutes of exercise is the equivalent to 5 milligrams of short-acting methylphenidate. Trialing medication. In 1/3 of people, ADHD medication will not be indicated. This may be due to levels of ADHD seen on the QB test, because of medical reasons, or because of history or background to difficulties. Using the QB test gives more data to help doctors see if a trial of ADHD medication may be indicated. In another third of people, ADHD medication may improve symptoms with a reasonable response. And in the final third, ADHD medication should improve symptoms with a good response. Why medication continued? In practical terms, where a trial of medication is clinically indicated, it may contribute to your child being less impulsive, less hyperactive, or have improved attention. All young people are different, and medication will affect all in slightly different ways, and that these outcomes are in conjunction of behaviour strategies being implemented also. Medication cannot work alone in management of ADHD symptoms. What happens re symptoms of ADHD? Dopamine and noradrenaline are two of the main chemical messengers in the brain. They play a part in controlling concentration and reward. It seems that too little activity from dopamine and possibly noradrenaline in some parts of the brain can mean the brain can't focus on anything and doesn't feel calm. Not enough dopamine in the reward parts of the brain mean the brain may often be looking for something exciting to boost dopamine and noradrenaline to make it feel normal. This can lead to the symptoms of ADHD, such as being easily distracted, impulsive, taking risks, smoking, and reward seeking. Types of medication as recommended by NICE guidelines. The first line of treatment most commonly used is a stimulant medication such as methylphenidate. If methylphenidate proves unsuccessful, an alternative stimulant medication, lisdexamfetamine or dexamfetamine, may be trialled. If all stimulant medications prove unsuccessful, non-stimulant medication atomoxetine or guanfacine are the next line medications. Following all of the above proving unsuccessful, on the rare occasion clonidine may be considered. This is usually trialled as an alternative if there are severe and impairing tics that continue to impact on the young person. Medications most often need a controlled start and end, meaning starting and stopping the medication needs to be done through the advice of the specialist service. Possible side effects: decreased appetite, weight loss, headaches, nausea, mood swings, trouble sleeping, dizziness, small increase in blood pressure and heart rate, irritability, tics, stomach aches, diarrhea, and on rare occasions, suicidal thoughts. If any of these side effects occur, this would usually be at the start of medication trial or when increased. These should not last long, however, please let the clinic know. There are a number of possible side effects when taking medication, with slight variations between each. As noted, it is possible to see these at the beginning of a medication trial or when the dosage is increased. However, do always let the clinic know about these at your young person's review or sooner if you are concerned. More importantly, when considering the rarer side effects, should you become concerned about your young person's mood and possible suicidal thoughts, do not hesitate to get in touch with your GP or the clinic directly. Also, in terms of rare side effects, it is nationwide policy to document any side effects, even if only one person experiences it, but it is important to always be aware of what they are. It is important to maintain good communication with the clinic and full attendance at regular reviews, so both the effects and side effects of the medication can be assessed and altered where needed. These reviews also include physical health checks. If your young person significantly struggles with some of the symptoms already, in particular tics, it is important to share this with a consultant at initial appointment so that the most appropriate medication can be selected, which is least likely to heighten these. Given the possible side effects, there are some occasions where medication would not be an appropriate treatment for your child. This includes any cardiac conditions or family history of such, as well as epilepsy and seizures. It is important to share this information with the consultant when discussing medication due to the heightened risks in these circumstances. How medication is monitored. An initial appointment with our consultant will be arranged, where the following will be discussed: young person's views, parent and carer views, consultant view, detailed information about medications, best medication and dose. When offered an initial appointment, it will be discussed about the young person's and the parent's or carer's views on medication, and if the consultant feels medication is appropriate. If it is agreed to begin a trial of medication, the consultant will discuss which medication and what dosage is best to begin with. The dosage of medication when first prescribed will be low and will be reviewed 1 week later, usually by telephone. This can then be slowly increased over the next few weeks until good control of any ADHD symptoms is achieved. To note, by having an initial appointment, it does not guarantee medication will be given, and both the young person's and your views will be taken into account should you wish to not go ahead with the trial after hearing all relevant information. Any side effects will be monitored closely during this time, with an appointment 4 to 6 weeks after getting to maximum desired dose. This will reduce to 6 to 12 monthly reviews, however, these can be more frequent if the need arises. Medication will be issued by the clinic in the first instance until satisfactory control of symptoms is achieved. This will then be handed over to your GP through our shared protocol. Due to the reviews being vital in the use of medication, should the appointment not be attended, medication may be stopped and the young person may be discharged from the service. It is important to be aware that medication used for ADHD is a controlled drug and must be monitored by a specialist service to ensure it remains at a safe and appropriate level for your young person with minimal side effects. At the end of this course, you will be asked to wait 12 weeks before asking for a re-referral to the service by either your GP or school should you wish to discuss a trial of ADHD medication, at which time you will then be added back to the waiting list for an appointment with one of our consultants. Here are some myths and facts. Stimulant drugs are dangerous and should not be taken by a child. Not true. Stimulant drugs are safe to use for young people when appropriately prescribed and monitored by a specialist service. Stimulants just cover up the real problem and do not deal with the causes of ADHD. Not true. ADHD is largely genetic. The medications work on some symptoms of ADHD for 60 to 70% of children with ADHD. Myth or fact? Stimulants make children high, as illegal drugs do, and are addictive. This is not true. There are no reported cases of addiction or serious drug dependence with these medications. Although the increased risk-taking with untreated ADHD may be more likely to cause them to seek other substances out, such as coffee, alcohol, or cannabis. Substance abuse is, and should be, a concern for parents of young people with ADHD. A recent study showed that teens and young adults with ADHD are at higher risk for substance abuse than others, but treating them with stimulant medications doesn't increase the risk. What the new study shows is that the risk is linked to the disorder, not to the treatment. They stunt children's growth. Mostly untrue. This is largely disproved, but this is why we monitor height and weight in clinic, so any change can be monitored. If a slide downwards does occur, then we will look at trialling another medication to see what impact it has. More myths and facts. Stimulants can be used only by young children. Not true. They can be used post-diagnosis, which is age 6 and upwards, and can be used in adulthood. If you're on stimulants, you can't join the army or the military. This is partially true. Although this does not mean young people with ADHD cannot ever join the army. Guidance is provided online, but do discuss this with careers advisors if your young person wishes to explore this career path. Strategies. APEG attendance, so you understand the principles behind managing ADHD. Routine. Structure and scaffolding. Timetabling. What relaxes or soothes your child. Very different for each individual. Next steps. Your young person may now be discharged, unless open to another area of the team. A trial of medication will only occur after all other approaches are utilised first, both at home and at school. Needs a re-referral to the service at least 3 months post-APEG input, and up-to-date school information will be sought to establish ongoing areas of difficulty. It's a trial only. No guarantee of success, although we have more medication options available now than ever before. What precludes trial? Cardiac history. If there is a first-line relative with cardiac history, then we would refer to cardiology. Illicit substances being taken. If self-medicating, we would advise stopping these before trial of medication. And low level of ADHD symptoms. Final thoughts. Good communication and full attendance to reviews to include physical observation appointments are vital in your young person's ADHD medical treatment. If you would like more information about the use of medication in young people with ADHD to read before an initial appointment, look up the NICE guidelines entitled Attention Deficit Hyperactivity Disorder, Diagnosis and Management. Thank you for listening. Don't forget, please bring any questions to our session.